Hi, I'm Dr. David Hill, and today we're going to be talking about symptoms of ear infections in infants. Now, knowing when an infant has an ear infection can be really quite challenging because they don't always show us the symptoms that an older child would. Take, for example, simply pulling at the ear. Well, young infants can't even reach their ears with any regularity. If they happen to get up there, it's usually by accident. An infant needs to be about 4 to 6 months of age before they can reliably grab at their ears. And at that point, they start doing it just kind of for the fun of it. I say they're taking inventory. They're checking out all their parts. So they grab at their ears because they're up there. At 9 months or 10 months, infants may actually calm themselves by rubbing on their ears. So the fact that a child is grabbing at his or her ear often means nothing at all. On the other hand, if he has had some cold symptoms for a while, especially, 5, 7 days of cold symptoms, and then starts to grab at the ear, it's a little better clue. Why is that? Well, usually an ear infection is a result of having a cold, and usually the cold comes first. So you have 2, 3, 4, 5 days of congestion, runny nose, some fluid builds up in the middle ear chamber behind the eardrum, and then that fluid becomes infected with a bacteria. So it's rare to see an ear infection arise with no cold symptoms whatsoever. Usually it's what we call a sequela. It follows the cold. Now, fever can be a very useful sign for ear infection, especially in an older infant who's had a fever for 3 or 4 days. If it goes beyond 3 days, that's unusual. You tell me your baby's had a fever now for 4 days, I want to know what's going on. I certainly want to look in the ears and figure out if they're infected. Very important. If your infant is a newborn, under 3 months of age, and has a fever, never assume that's an ear infection or a cold or anything else. That baby needs to be checked out by a doctor immediately. That could be a sign of a very serious bloodstream infection, kidney infection, or even infection of the fluid around the brain and spinal cord, a meningitis. So, how else are we going to know that your baby has an ear infection? He or she may just be fussy, uncomfortable, crying a lot, feeding poorly. We really don't know until we look in the ear. One more thing. Parents tell me, well, there's wax coming out of the ear, or the ear looks red. I have no idea what to make of that. I don't know. Usually ear infections don't cause the outer ear to be red. It's really something that happens behind the eardrum. So until I get a really good look in there with an otoscope, an instrument specifically designed to see the eardrum, I'm really not sure what's going on. Now, they do sell otoscopes that are marketed for parents. They're lousy, and most importantly, you have to have hundreds or thousands of ear exams under your belt before any of it makes any sense when you're looking at it. So if you're worried, take your infant to see his or her doctor, and they can look in and tell you, usually pretty quickly, what's going on in those ears. Talking about symptoms of an ear infection in an infant, I'm Dr. David Hill.